My hands are washed. I'm entering to my patient's room.
Hi, my name is
Evina Gimre. I'll be your nurse practitioner today. I'll be examining and interviewing you for your routine annual physical today. You can feel comfortable. This visit will be completely confidential unless you have thoughts of harming yourself or other. I have to report this, okay? You can feel comfortable. Can you please tell me your first and last name?
My name is Angelina Sebastian,
And your date of birth?
December 1st, 2009.
Perfect, thank you so much. So this is Miss Angelina Sebastian. She is 15-year-old female. Her date of birth is December 1, 2009. She presents here for routine annual physical checkup. No any chief complaint noted at this time. No any past medical history or surgical history. No any family medical history as per the mother. And she doesn't have any allergies to any egg, food, environment, or latex. As for her birth history, she is a 40-week full-term baby delivered by a cesarean section, 6 pound 10 ounce weight, 18 inches in length, and her head circumference was 34 centimeter. Upward score was 10 out of 10. And she meets all her developmental milestones according to her age. No any parental concern verbalized at this time. She is up to date with her vaccination, including the COVID, flu, and the HPV vaccine. Are you in any pain, Angelina?
No.
No any pain verbalized. Her vital signs are within normal limit. Blood pressure is 100/60 mmHg. Heart rate is 80 beats per minute. Temperature 98.4 degree Fahrenheit. Respiration is 18 breaths per minute. SpO2 is 100% on room air. Her current height is 5 feet 1 inches tall. Weight is 98 pound. And she is currently 95 percentile on her GOAT chart, which is normal. And her mood looks very calm, not in any distress, dressed appropriately for the weather. Skin color is appropriate for the ethnicity. Neuro assessment. So can you please tell me your name,
Angelina Sebastian,
your date of birth,
December 1st, 2009.
and do you know what month this is right now?
March.
Okay, and can you please tell me who is the president of United States right now?
Donald Trump.
Okay, and can you tell me where are you right now?
I'm at the doctor's office.
So this concludes that I was checking Miss Angelina's mental status. She is alert, awake, and oriented times 4.
to person, place, time, and situation.
Now cranial nerve assessment. So I'll start with the cranial nerve 1. For that, I'll have you close your eyes. And then you have to close one nostril with one of the hand. I'll let you smell something. You tell me what you smell.
Lemon.
And do it with the other nostril while closing the eyes.
Lemon.
Okay, that's good. This is lemon. So this confirms cranial nerve 1, olfactory nerve is intact. Now I'm going to assess for cranial nerve 2, which is the optic nerve. So for that, I'm going to test you with the peripheral vision. For that, I will have you cover your left eye, Angelina, and then I'll do the same. I'll cover my right eye. And then don't look at my finger, but tell me how many fingers do you see?
1, 2,
Okay, that's good. And let's repeat it with the other side.
1, 2.
Okay, that means cranial nerve 2 is also intact. The peripheral vision is intact. Now I'm going to assess for cranial nerve 3, 4, and 6. For that, I'll be using like X test. This is to check for the extraocular movement. So you follow my finger with your eyes. Okay. So the pupils are converging equally, and then I'll check the accommodation at the same time. Okay, again the pupils are converging like equally. And then for the next test, I'll be using my pen light. I'll flash a light on your eyes and I'll see your pupil if they are constricting equally. So let me flash the light on one eye, and I'm flashing your light and looking at the other eye. It's constricting properly. I'll repeat the same with the other eye and flashing the light on the eye, and the other eye is also constricting properly. Eye is intact. That means pupil is equal round reactive to light and accommodation. Now I'll assess your cranial nerve 5, which is the trigeminal nerve. For that, I will have you clench your teeth, and then I'll palpate your masseter muscles. Okay, I'll have you open your mouth with resistance. Okay, so cranial nerve 5 is intact. Now I will assess cranial nerve 7, which is the facial nerve. For that, I'll have you smile, and can you frown for me? And can you make a puffy face? And then close your eyes and then tell me when you feel, like, you know, whenever you feel the touch, you can say now.
Now. Now. Now.
Okay, so cranial nerve 7 is also intact. Now I'm going to assess for cranial nerve 8. For that, I'll cover your one ear and then I'll whisper something from the other ear, and you can tell me what do you hear.
Apple, banana.
Okay, I'll do the same from the other ear.
Pineapple cake.
Okay, so that means like cranial nerve 8, vestibulocochlear nerve is also intact. Now I'm going to assess cranial nerve 9 and 10 together. For that, I'll be using a tongue depressor. I'll have you like say ah, and stick out your tongue for me, please. Okay, so I could see the uvula is rising to the midline. It's in the midline, and I'll check the gag reflex at the same time. Okay, so I see the gag reflex is also elicited, and Angelina is talking to me in a normal voice. There is no any hoarseness and no any difficulty swallowing, right? So that means the cranial lobe 9 and 10 is also intact. And now I'm going to assess the cranial lobe 11, which is a spinal accessory nerve. For that, I'll have you turn your head from side to side and then up and down. And can you please shrug your shoulder for me? Okay. So cranial lobe 11 is also intact. And now cranial lobe 12, which is the hypoglossal nerve. Can you please stick out your tongue and put it side to side? Okay. So cranial lobe 12 is also intact. So all the cranial lobe 1 to 12 is intact. Now moving on to motor function. First, I'm going to start with inspection. I'm inspecting your clavicle and your shoulder. It looks symmetrical. And inspecting your hands and also inspecting your scapula. And now moving on to palpating the joints. I'm going to start with palpating the sternoclavicular joints and acromyoclavicular joints and spine of the scapula. No any tenderness noted. And then also palpating the shoulder and palpating the hands and palpating the elbows. No any tenderness noted. And upon inspection of the muscles also, there is no any bruising or no any discoloration noted. And then I'm going to extend your hands like this, palpating the radio-ulnar joint. Now palpating the wrist joint. No any tenderness noted. I'm going to also palpate the greater trochanter of the humerus. No any pain, right? No. And now I'm going to palpate the radial pulse also. It looks nice, +3. And I'm going to repeat same in the other hand, palpating the radial pulse. It looks nice, +3. And now I'm going to palpate the brachial pulse. +3, repeating the same on the other hand. +3, which is a normal finding. Now I'll be assessing the cerebellar function. For that, we'll be checking the balance and gait first. For that, I'll have you walk first. Angelina, can you walk on your tiptoes? Tippy toes. Very good. And then, very good. It looks a very balanced gait. And then when you come from here, can you walk on your heel? Okay, very good. Gait looks very steady gait and symmetrical. And also, can you walk from your toes to the heel like this to here? Okay, very good. Looks balanced gait, very symmetrical movement. Have you hop on one foot, please? Okay, that's a very good range of motion and good strength. And then if you can come up to here, now we're gonna do the come up to here and we'll do the Romberg test. For the Romberg test, I will have you close your leg together and keep your hands straight. And first, without her eye closed, I'm gonna assess for Romberg test. I'm gonna just keep my hands to support in case there is any wobbly or uncoordinated movement. No any abnormalities noted. And now we're gonna repeat the same thing with your eyes closed. Again, I'll put my hand here. No any swaying noted, which is a normal finding. So after that, we will do the pronator drift. For that, I'll have you sit over here. For the pronator drift, I'll have you sit here a little bit close to me. If you could, lift your arm up like this position. So I'm gonna see it for about 10 seconds. There is no any drift noted. This is to check for
Upper extremity weakness.
So now I'm gonna check for coordination. So for that, I'll put my finger here. And if you could, touch your finger to your nose to my finger. Yes. Okay. 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 So this means the coordination is also normal. So this is a normal finding. So Angelina is a 15-year-old, very cheerful girl who falls in the middle adolescence stage, who meets all her physical, emotional, cognitive development according to her age. So now moving on to the sensory function, starting with the exteroceptive perception, I'm gonna assess Angelina with 3 different kind of objects. So I'll explain you. This will be like sharp, and this cotton tip will be soft, and this will be like a dull touch. So with your closed eye, I'm gonna assess with the both hand. You can tell me what kind of sensation you feel.
Soft.
Okay, very good.
Dull.
Very good.
Sharp.
So okay, so the sensation is intact. So the next thing I'll assess for superficial pain. For this, I'm going to use this sharp stick. I'll try to touch like on the both hand and tell me when you feel the pain. You can say now when you feel the pain with the closed eye.
Now. Now.
Okay, very good. So superficial pain is also intact. So the next thing will be temperature sensation. For this, again with your closed eye, I'm going to give you one hot cup or one cold cup. You're going to tell me like what kind of temperature you feel with your closed eye. Okay.
Hot.
Very good. And with the other side.
Cold.
Okay. So this means the temperature sensation is also intact. So next thing I'm going to move on to the proprioceptive perception. This is to check for the motion and position. For this, I'm going to take your finger, Angelina, and then I will have you close your eye. And then you will tell me what side your finger is moving, either up or down.
Up. Down.
I'm going to do the same thing with the other finger.
Down.
Okay, so the position is intact. So the next thing will be vibratory sensation. For this, I'm going to use this tuning fork. Strike it over, and again, I will have you close the eye. And you're going to say when you stop feeling the sensation.
Stop.
Okay, same thing with the other hand.
Stop.
Okay, so the vibratory sensation is also intact. So the next thing will be cortical sensation. For this, I'll have you identify some object with your closed eye. So I'm going to let you identify it. You can identify what object is that. Okay, very good. And same thing, I'll give you a different object this time.
Pin.
Okay, so this means the stereogenesis is also intact. So after that, we'll move on to the graphitasia. This is also the cortical sensation. For this, I'm going to have you again close your eyes, and I'm going to draw something in your hand, and you will identify what did I draw.
A.
Very good. And same thing with the other eye.
O.
Very good. So that is also intact. That was the graphitasia. I'm going to do the extension now. For extension, I will have like, I'm going to take a pen, and then I'll tell you like what side you feel the pain, okay? You can close your eyes, and you can just tell me like what side you feel it, like which hand.
Right.
Very good.
Left. Left.
Very good. So that is also intact. So the last thing will be the 2-point discrimination. For this, again with your closed eye, I'm going to touch your hand, and you will tell me how many touch you feel, either 1 touch or 2 touch, okay?
2. 2.
Okay, very good. So this concludes that the sensory function is intact. Now assessing the deep tendon reflexes, starting with the bicep. I'm going to hold your hand, and I'm going to go find the bicep, and I'm using the Paterson hammer. Okay, I can see the contraction of the bicep while seeing the flexion of the forearm. Repeating same from the other arm. I'm going to percuss. Okay, I see the contraction of the bicep, and there is the flexion of the forearm. After that, I'm going to do the brachioradialis reflex. So here, brachioradialis, I'm going to percuss it. So I see there is a supination of the hand and also slight flexion of the forearm. Repeating the same from the other arm. Brachioradialis. I see again there is a supination of the hand, and there is slight flexion of the forearm. And I'm going to go ahead and do the tricep reflex first. For that, it will be here. And then I'm going to use my percussion hammer. Okay, I see the contraction of the tricep, and there is extension of the forearm. Repeating same on the other arm. Okay, there is the contraction of the tricep, and also there is extension of the forearm. And moving on to the patellar reflex now. Patellar will be here in the knee. I'm going to palpate the patella first. No any pain, right? Okay, so I'm going to use the hammer. Okay, I see the patellar reflex is present, and same thing on the other side. Okay, the patellar reflex is present. And moving on to the other reflex, Achilles tendon, which will be here. I'm going to just first dorsiflex the foot. No any pain, right?
No.
And Achilles will be right here above the heel. So I'm expecting the foot to plantar flex. I'm going to again do the same thing on the other one. So first dorsiflexing the foot a little bit, and I'm going to use the percussion, and I'm expecting to see the plantar flexion of the foot. No any pain, right?
No.
So far these are the reflexes, and for these next 2 reflexes, I'll have you lay down here, Angelina, comfortably. This will be our abdominal and the plantar reflex. And for the abdominal reflex, I'm going to use a little bit sharp object. Let me know if there is pain, okay? I just try to make you as comfortable as possible. I'll have to use this sharp object and I'll go over with all 4 quadrants of our abdomen. Okay, 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 okay. I see the contraction of the abdominal muscle, which is normal, no any pain there, right? So, and the last reflex that I'm going to be assessing will be plantar reflex. For that, I'm going to go over here to the feet side, and that will be on the feet portion. And then for that, I'm going to draw like a J angle using this other side of the hammer. Okay, so that's normal what you see. Her fingers were coiling forward, that is normal. And same, I'm going to do it with the other foot. Again, her fingers were curling forward, which is normal in her age group. So no fanning noted on the plantar reflex, which is a normal finding. So musculoskeletal assessment. Upon inspection, there is normal muscle bulk noted. There is no any abnormal movement such as tremor or no fasciculation noted. So I'm going to next evaluate her for scoliosis. For that, I'm going to look at her acromion process, which is the shoulder level. Both level looks equal in height, and also the pelvic level also looks equal in height. And then the head and neck is midline, and anterior rib cage is also symmetric. And the distance between her arms at the elbow and the torso should be equal, which is in your case. And then Angelina, I'll have you turn over to your back, and then look at the waistline is also same on both sides, and I'll have gently palpate over to your spine. No any pain, right? No tenderness noted. It looks straight and symmetric. So this finding looks negative for scoliosis, which is a normal finding. Thank you. You can turn back to me. So moving on to range of motion now. We'll start with the cervical range of motion. For that, I'll have you touch your chin, put your chin down and up, and then turn to the left and then right towards the direction. And then for the thoracic range of motion, I'll have you bend over to the side, there, and to the other side. Then that's the thoracic range of motion. And for the lumbar range of motion, I'll have you turn to the back. And then if you could forward bend, I can support forward bend, and then come back. And then if you could backward bend, okay, that means the range of motion is good. So now range of motion of the upper extremity. We'll start with the shoulder. I'm going to first palpate. No any crepitus, notice, no any pain, right? So I'm going to have you abduct your hands, shoulder, and then adduction, bring it back, and then forward, bringing the hand, and then the backward rotation, and then can you shrug your shoulder? Okay, that's a normal range of motion for the upper extremity. And then I'll do the same thing for the hand, like flexing and extending, and same thing again, flexing and extending. And for the wrist also, I'll do the same thing, flexing, extending, and flexion and extension. And in the same time, I want to check the strength. And then can you pull me against your resistance? Okay, very good. And I'll put my hand to this side. Can you push me against the resistance? Okay, very good. This is a normal strength, 5 by 5. Now I'm going to check the range of motion on the lower extremity. So for that also, sorry, I'll have you stand up. So all you have to do is I'm going to check with the hip range of motion. Can you bring your leg forward, one leg, and then backward? Okay, very good. And same with the other leg, bringing it forward and bringing it backward. No any pain, right? And I'm going to have you do the same thing to check for the knee, like same thing, bringing it forward, which is the extension, and the flexion will be bringing it back, and again extending for the knee, and again flexing for the knee. That's very good. And in the same time, I will have you like hop on one foot, please. Okay, that's a very good range of motion and good strength. And I will have you sit down in there carefully. I want to check the strength on the lower extremity. For that, I'll have you pull me against the resistance. Very good. That is 5 by 5. And same thing, can you push me against the resistance? Okay, that is also normal strength, 5 by 5. That concludes that Angelina has a normal range of motion and normal strength, 5 by 5. As an anticipatory guidance, I discussed with Angelina on topics such as acne, care for her skin, body image, bullying, peer pressure, parent pressure, drinking, drugs, safe sex, STI, STDs, firearm safety, seatbelt use, and importance of immunization. Additionally, I also screened her for depression using the PHQ-9 tool, and the score for the PHQ-9 score is 0, which is normal. So summary of my findings: no any abnormal finding noted at this physical exam. Her ICD-10 code is Z00.129, which is a routine child health examination without abnormal finding. No any referral needed at this time.
Thanks for watching.